Jack, Patty, Holly, Brady. Dr. Kevin Kavanagh is our resident expert when it comes to germs. He's a real germy guy, and he is our Dr. Fauci of Central Kentucky. And we're working on the bobblehead for you, Dr. Kavanagh.
Well, thank you, Jack.
Yeah. And I was telling Holly, I said, the thing about Dr. Kevin, you always know where you stand with him. If you don't hit the spots that he thinks you should hit, he'll tell you. And so we had him on Wednesday, and, of course, the president had just dissed the World Health Organization, and I thought that's what we ought to be talking about. But as soon as you're off, I get this long email saying, most important, not WHO, followed by this list of things that we should have talked about. Well, guess what we're going to talk about today? Whatever in the hell you want to talk about, Dr. Kavanagh. Now, what you said was the most important thing is food safety, Whole Foods not requiring masks, which surprises me. Meat packing plants.
They are requiring masks.
Well, that's what you said. They aren't.
Oh, I'm sorry. They are.
Okay,
I probably messed up there.
Okay,
yeah, they are.
Meat packing plants, workers coming down with COVID-19. Smithfield Meats, I guess is what you're talking about, with 283 positives. And JB Meats in Greenlee, Colorado, 3 workers positive. And you'll go on to say that cold preserves the virus, so anything refrigerated or frozen does not kill it. Is that still a problem that we need to talk about?
Well, I think so, yes. I still need to eat today, and I want to make sure I've got good, safe food. And so I think it's important that people understand how to handle food, how to get food, and that reopening the economy, at least some aspects of it, isn't just the stock market. And they said that yesterday in the briefings. You also have to make sure that the supply chains keep flowing.
Right. That's true. If you were given the opportunity to say how this should work, how should we go back and open the country? How would you do it step by step? Or have you even thought that far?
Well, I have, and it's very difficult, Jack. The idea of what they're doing is that we would drive down the death rate so low into high single digits, let's say 9 per day in the entire United States, and then public health would do case following. And I don't know if that's going to happen in our country because of the demonstrations, the churches. We just do not have really optimal compliance with social distancing and staying at home. And this is true even in grocery stores. I've noticed lines outside the grocery stores waiting for them to open that are very packed. People are not wearing masks. You should wear masks in a grocery store. I feel all food handlers should be wearing a mask. And Whole Foods is now requiring food handlers to wear a mask, and also for patrons. And for me, I prefer to go to an establishment such as Whole Foods, although I'll be honest with you, Whole Foods is kind of a specialty niche type of a grocery store.
Right.
Primarily I've been shopping at Kroger and the many other outlets. And when I say shopping, I'm now doing online and having the food delivered. Wipe it down. We've got a good video that Sanjay Gupta made that we've linked to on the Health Watch USA website. And also, I will leave the food out if it's non-perishable for about 3 days at room temperature. Some studies indicate that will deactivate the virus, and then you can wipe it down and safely put it away. So I think ordering online and having it delivered is very good. Try to do that only once or twice a week so you don't outstretch our food delivery system. And you need to make sure that you remember and appreciate the food handlers and the food deliverers, because those are really frontline workers too. They're coming down sick. Similar to the healthcare workers, they are right out there up front, and they do need protective gear.
Well, I have a couple of questions for you, Dr. Kavanagh. And this is kind of going back to the meat packing stuff, but I guess it's kind of twofold. One is, are you saying that they can get the coronavirus onto the meat itself and that would come into our house and that we would maybe get it from eating the meat, number one? And then number two, if the answer to that is yes, do we kill the coronavirus when we cook the meat? Or
Oh, yeah, definitely. The coronavirus is not a real stable entity in the environment. Just like salmonella or anything else, if you cook it, it zaps it. And so what I would suggest with the meat, if it's frozen or if it's refrigerated, the virus lives for an extremely long period of time. I mean, months. You hear about viruses being activated in the tundra millions of years ago as that's thawing. I just handle the meat with either your bare hands or gloves. If it's bare hands, be sure to wash your hands right afterwards and cook it, and that will take care of it. And then the same goes for a lot of foodborne diseases. If you hear about salmonella and all the other types of food diseases that you can get, anything that's cooked is safe. The big problem comes in like lettuce, and you can get sick from lettuce, and there's been outbreaks of E. coli, etc. That's difficult to wash. So to me, the really fresh vegetables poses more of a danger because they're not cooked, but most of those you can wash off with soap and water before you eat them. Soap and water is not a bad thing to use on this virus. It will wash it off, and there is some evidence that the soap will deactivate the virus because the virus has a lipid type of a capsule. If you don't have soap and water, then of course we've talked about the 60% or greater alcohol to use that for sanitization. And I would view that as almost second best. The big advantage of the alcohol is you can use it when you don't have a sink. And if you don't have a sink and you get soap and water on your hands, it's kind of if you get soap on your hands, it's a gummy mess if you don't have the water to wash it off.
Well, can we use, you're talking about the alcohol for sanitizing, or even, we've had that bleach water, kind of recipe that people have been using on surfaces. Can we put that on fresh produce and then rinse it off, or is that going to contaminate the produce in a different way?
Well, that I don't know, to be honest with you. I think soap and water is the safest. Alcohol, personally, I wouldn't be too opposed to using that on fruit because that will evaporate quite rapidly. But even that would be a second choice. I would go with the soap and water and washing it off. Because the rubbing alcohol, you shouldn't be drinking that. That can be very toxic. So those type of disinfectants are not designed to be consumed. And the question is, if you use it on the fruit, will that be absorbed, etc.? And so I think soap and water and washing it off real good is something you can do. And also, if you can leave it out for 3 days, in other words, order the green type of produce, if you leave it out for 3 days, that should result in the virus being deactivated, or the majority of it.
Let me ask you this. Are we past the peak in the country?
I'm not sure, Jack. I have been looking at the data, and the modeling site I was looking at stopped updating the data, and we're between 10 to 20% above the deaths on what they had modeled. On the other hand, they're finding a lot of people that have died that weren't in the original model data. In other words, they're dying at home, or not all the nursing homes deaths were counted. And so it's really hard to tell. But I don't think we're on the downward slope yet, and that's why opening up the economy really kind of scares me.
So do you think the country as a whole should be on the downward slope, or should we open it up based on, they're forming these little coalitions of a half a dozen states to make the determination when they should open, or should we wait until the whole country has passed peak? What do you think?
Well, the whole country would be optimal because, unfortunately, we tend to travel between states and carry the virus. And if you have one state with a low virus and another state with the high virus, people in the state that have a lot of the viral outbreaks may go to the state that's less contaminated, and some of them bring the virus with them. So I think a national policy is preferable. The state coalitions are kind of a stopgap, next best working together that you can do. And, of course, the worst would be each state doing their own thing.
Yeah, I see where that would be a mess. Yeah. All right, we're taking a break. If you have a question or comment, we want to hear it. Dr. Kevin Kavanagh, he's the founder and president of a national organization called Health Watch USA. He's a retired physician. Dr. Kevin Kavanagh is our guest this morning, and we love to kid him. I hope you guys realize we're just we like to give him a hard time. But I do have a question here from our Auto Tech Service text line, Kevin, that says concerning coronavirus, would a basic baby wipe that contains no alcohol, only soap, kill the virus? I guess they're asking if a baby wipe would work.
Well, the recommended CDC guidance is to use either soap and water or alcohol. So if your baby wipe has soap in it, that may definitely work.
Okay.
I know I said may indefinitely. That's really hedging. But as I said, there's some indications that soap actually would deactivate the virus because it has a lipid capsule. So the soap is not, it may actually be much better than alcohol. Oh. There's some research with alcohol that if the virus is coated in mucus, it may not be that effective. So just going back to the cleaning of the food, the soap and water is going to be preferable. And I should note that when I say alcohol, I think for me it's important to go with the alcohol that's the ethanol type of products, because ethanol is the alcohol that you drink. There's some types of alcohol, even though it'll kill viruses, can be very toxic if it gets inside of your body.
Okay, let's go to the phones. Logan, good morning. Thanks for holding.
Good morning. Just have some comments regarding meat and meat slaughter. And I've been involved in agriculture for a long time, and I am a cattle producer here in Kentucky.
Great.
One of the things I wanted to bring up is and Dr. Kavanagh was talking about Whole Foods, is a lot of the meat that Whole Foods offers comes from Marksbury Farms, which is down between Lancaster and Danville. And that is a USDA certified slaughter plant. And that meat is primarily from Kentucky producers. This is a problem we've had in agriculture for a long time, particularly livestock agriculture, is Kentucky is in the top 10 of cattle producing states in the United States. Why are we getting our beef from a slaughter plant in Colorado? And you talked about that JBS plant out in Colorado.
Yeah.
JBS is a Brazilian company that owns that plant. That doesn't mean it's Brazilian beef, but it's a Brazilian company that owns that plant.
Interesting.
Smithfield Foods is owned by a Chinese company. It is not Chinese pork.
Yeah.
It is not pork from China, but it is owned by a Chinese company. The problem we've had is the concentration of slaughter plant capacity in this country, and you're seeing the problems with that. Not just there's many economic problems with that, because there's a tremendous disconnect from cattle prices versus the beef in the grocery store, but you're also seeing it with this, I'm going to call it the Wuhan virus problem.
Yeah.
The other thing I'm going to say, and this might be pretty wild for you, Jack,
okay,
is get Congressman Massey on and do an interview with him, because he has sponsored a bill in the House of Representatives called the U.S. Prime Act, and he is a cattle producer as well.
Oh.
Which would allow the easing of the inspection requirements for small local slaughter plants. Doesn't mean they wouldn't be inspected, but you cannot have the same requirements for a local slaughter plant that's doing 20 steers a week versus the JBS plant that's doing 15,000 head a week. And anytime you get the local things more local, I think it's better for the economy, and I think it's healthier. So that's all the comments
I appreciate that. I appreciate that a lot. The problem is the consumer doesn't know all this stuff.
Well, this is a whole nother subject, and this is, if you want to talk to Jim Akers, he's the chief operating officer of Bluegrass Stockyards. He's an excellent resource.
We've had him on before. That's a good idea. I'm about to run out of time, but we're not going to let this one rest. Okay, I appreciate your call.
That's another.
Yeah. Okay. Thanks.
Yeah.
Kevin.
Another reason to shop at Whole Foods.
Right.
Kentucky beef and wearing masks.
Yeah, and we had John Mark Hack on from Mark's Berry Farm, sort of talking about how easy it was to get things locally, and I didn't realize they sold at Whole Foods, but now we know.
Okay, Kevin, we've got a minute and a half, so wrap us up here. What's the message today?
Well, the message is follow the governor's guidance, stay safe, stay at home. This virus is not political. It does not respond to political ideologies. It does, however, respond to science and doing what's safe. So I would say follow the science, and that's the most important thing to do right now.
Well, I gave you a minute and a half, and you gave me 30 seconds.
Oh, I'm sorry.
Okay.
Usually only give me 30 seconds.
No, I gave you a minute and a half, so keep going.
Well,
Keep
that's
going.
fantastic.
Yeah.
But definitely wash your hands. Don't touch your eyes, nose, and mouth. Stay 6 feet or greater away from people. And please, if you go shopping, wear a mask, a DIY mask, not an N95, but a DIY mask when you go shopping to protect other customers and patrons in the shopping facilities. And I would really like to see the food handlers that are making my pickup orders to be wearing masks. I think that's just a courtesy to the patrons.
Have a good weekend. Thank you for being with us. We'll talk to you on Monday.
Thank you, sir.